In this video, I'm going to talk about the false belief that disc degeneration in the spine will always and universally cause spinal pain. Disc degeneration is a natural aging process and does not cause pain in all circumstances. I'm Dr. George Ampat. I work as a consultant orthopedic surgeon and I work in Liverpool in United Kingdom. In medical practice, it is very commonly assumed that the cause of the spinal pain, either in the neck or in the lumbar spine, is the degeneration seen on the MRI scans. This is not true. Ideally, the condition should not be called degeneration. Degeneration makes it seem that there is something rotting or degrading inside the disc. That is not the case. This is an age-related change. Everyone who is becoming old is not rotting or degrading. The proper terminology for the condition is disc desiccation or disc dehydration. Disc desiccation just means that the disc has lost its water content and is darker in appearance on a particular sequence of the MRI scan. And that is an age-related change. Though it is an age-related change, it can prematurely occur in the young. It is likely to occur more in the spine is overstressed. Elite tennis players and sportspersons are known to have increased disc desiccation. Extreme sports causes significant stresses on the disc which may lead to premature desiccation. Most importantly, there is no scientific evidence to suggest that disc desiccation will always cause pain. There is some evidence that disc desiccation may sometimes cause pain, but it's not true that disc desiccation will always cause pain. It is common to see patients who experience neck or lower back pain following a work or road traffic accident. They could have been asymptomatic prior to the accident, i.e., did not have neck or back pain prior to the accident. To investigate their ongoing pain, MRI scans are usually performed. Unfortunately, sometimes the MRI scan shows disc desiccation. It is then wrongly assumed that the pain is not related to the accident and only related to the disc desiccation. This is not true. Disc desiccation does not always cause pain. It is possible that the pain that they are experiencing is due to the accident. It is wrong to always attribute the pain to the disc desiccation. There are many patients who have no disc desiccation and who will still experience back pain. These patients are not lying. Their pain is real. One can experience neck and back pain without any evidence of injury or disc desiccation on the X-rays and the MRI scans. Equally, there are patients who have disc desiccation on the MRI scans but have no symptoms of back or neck pain at all. This is also real and true. Disc desiccation is an age-related change. This is like the wrinkles on the skin, a bald head or grey hairs. The wrinkles on the skin, a bald head or grey hairs are age-related changes seen on the outside. Similarly, disc desiccation is an age-related change that occurs inside the spine. Individuals over the age of 60 are likely to have desiccation of multiple discs. That is just natural as it is the normal aging process. It is also true that most older adults over the age of 60 do not experience neck or lower back pain. This is the MRI scan of a young person who experiences low back pain. This is the sagittal view of the lumbar spine or the lower back. I have highlighted the individual vertebrae. I have now highlighted the intervertebral discs. The spinal column consists of alternating vertebral bodies and intervertebral discs. The vertebral bodies are labeled B and the discs are labeled D. The vertebral bodies are made up of bones and the discs are made up of cartilage. there is no desiccation of these discs. There is also no compression of the nerves that are running behind the vertebral bodies and the disc. I have now highlighted the spinal cord and the spinal nerves running through the spinal canal. It is clear that there is no compression of the spinal cord or the nerves. Even though there is no disc desiccation, even though there is no compression of the spinal cord or the nerves, the patient is experiencing lower back pain. Just because there is no disc desiccation or compression of the nerve roots, it does not mean that they are not suffering from pain. Their pain is real, and as a doctor, I attempt to help them with their pain. This is an MRI scan of an older adult. This is the sagittal view of the lumbar spine of the older adult. We can see that there is disc desiccation at multiple levels. In addition, there is also compression at the L4-5 level. That is at the level between the L4 and the L5 vertebrae. Though there is disc desiccation at multiple levels, and though there is compression of the nerve roots at L4-5, this individual does not experience any back or leg pain. This individual is able to walk distances and is also able to carry heavy loads. If all disc desiccation would cause pain, one would wrongly assume that this person whose MRI scan is seen would be experiencing severe back and leg pain. That is not the case. I would also like to quote some research studies to provide further proof regarding this. The first study I would like to quote is from India, and it investigated 50 individuals between the ages of 15 and 30 and who had no history of low back pain. This study showed that 56% of asymptomatic individuals, i.e. individuals with no complaints of any back pain, had some form of disc pathology. The second study that I would like to quote is from Nottingham in United Kingdom. This study investigated 36 professional cricket fast bowlers and 17 active controls. The average age of professional fast bowlers was 26 and the average age of the active controls was 25. 61% of the fast bowlers and 53% of the active controls had evidence of disc desiccation on MRI scan. In addition, 17% of the fast bowlers had severe disc desiccation at multiple levels. All these subjects, including both the professional fast bowlers and the active controls, were asymptomatic, i.e. individuals who had no complaints of any back pain. The third study that I would like to quote is from the United States of America. This study investigated 98 people without symptoms of back pain and who were aged between 20 and 80 years of age. This study showed that 64% of the subjects showed a disc abnormality but did not experience any back pain. The fourth study I would like to quote is from London in United Kingdom. This study investigated 33 asymptomatic elite adolescent tennis players whose mean age was 17.3. They were very young. They were adolescents. 39.4% of these young adolescent tennis players had disc desiccation. Again, these adolescent tennis players had no symptoms in the lower back. The fifth study I would like to quote is from Korea. The study investigated 102 asymptomatic subjects aged between 14 and 82. MRI scans showed that 75.8% of the subjects had disc desiccation. They were again subjects who had no lower back pain or any symptoms in the spine. This study also showed that disc desiccation increased with age. Hence, it is an age-related change. Though it is an age-related change, it can occur in the young. Young tennis players and fast bowlers are likely to use and stress the spine more. The increased stress may lead to the desiccation. The above evidence clearly shows that there is no clear evidence that disc desiccation will always result in spinal pain. In conclusion, patients with and without disc desiccation can experience low back pain and neck pain. The spinal pain in patients who have neck and low back pain cannot always be blamed on the disc desiccation. There is some evidence that disc desiccation may be related to back and neck pain, but the evidence is not strong. Even if there is desiccation, the answer to the solution is to exercise and build up the muscles around the spine. It is like the tires on the car. If the tires are well inflated, the car drives well and there is less stress on the shock absorbers. If the tires are underinflated, then there is a greater stress on the shock absorbers and they are likely to fail. Similarly, in the human body, if the muscles surrounding the spine are strong, then there is less chance of the disc desiccating. Even if the disc has already become desiccated, it prevents it from becoming worse. Strong muscles protect the disc just like strong and well-inflated car tires will protect the shock absorber. Thank you very much for listening. If you enjoyed watching this video, please like, share and subscribe. Though I am an orthopedic surgeon by training and practice, my main focus is on helping patients with musculoskeletal pain without surgery and with lifestyle practices. I have written self-help books to empower patients to find relief from their symptoms. The QR code provides a link to my books on Amazon. These books are also available on my website ampat.co.uk. Thank you so much for listening. Goodbye.